Hello, I'm Annette Young and welcome to the 51%, a show about women reshaping our world. Coming up, we take a look at the lack of female leaders in the scientific and medical fields and talk about what that means for the fight against Covid-19 with Professor Sarah Hawkes, a specialist in gender and health at University College London. We also meet some of the few women scientists and doctors who are leading the battle against the virus. But first, and according to the UN, women make up some 70% of the health and service workforce, yet only 30% of leaders in the global health sector are female. Fraser Jackson and Kathy Kedder-Clifford take a look back at the underappreciated yet crucial role that women have played throughout the history of medicine and science.
In ancient Greece, women practiced medicine across most cities. But from 400 BC, they were gradually limited to gynecology. In Athens, they were accused of carrying out abortions, a crime at the time. Practicing medicine became punishable by death for women. Legend has it was thanks to the rebellion of Agnetus, a young girl who disguised herself as a man to practice medicine, that the law was finally repealed. From then, women had some freedom to practice medicine. In Rome, female doctors known as medica were even considered equal to their male colleagues. In the Middle Ages, caring for the sick fell mainly upon women, in particular nuns. It was at this time that the Italian woman Trotta of Salerno worked as a doctor and surgeon. She also taught at the prestigious Salerno School of Medicine and wrote several reference books about gynecology. Yet her works would later be attributed to men. During the Renaissance, the specialist knowledge held by midwives and female healers attracted much suspicion. As a result, tens of thousands of women were accused of witchcraft and executed. In the 18th century, the Age of Enlightenment allowed some women to gain importance, but 100 years later, they were still excluded from scientific teaching. Despite all of it, some persevered and found their place within the world of science. In 1911, Marie Curie won the Nobel Prize for her work in chemistry, but not all female scientists were recognized in their time. British biologist Rosalind Franklin is known today as one of the most important scientists of the 20th century. She was behind groundbreaking research into DNA. But her work was taken up by three researchers in 1962, who received the Nobel Prize for Medicine in her place.
Joining me now from Cambridge is Professor Sarah Hawkes, the Director of the Centre for Gender and Global Health at University College London. She also is the co-founder of Global 50/50, an independent research initiative on gender equality and health equity. Thank you so much for your time, Professor Hawkes. When it's estimated that only 30% of leaders in the global health sector are indeed female, how does this impact the way in which the pandemic is being managed?
One concern could be that we're kind of making a fuss about nothing and that it doesn't matter who's in charge because as long as you've got good leadership, then what difference does it make if it's a man or a woman? And there's an element of truth in such a response. But from the data and the evidence that we've collected over several years now, we are fully aware that if you have women in charge of organizations in global health, that you're more likely to have those organizations deliver policies and programs that are sex and gender responsive. In other words, that take differences between people into account, and that then makes a difference in terms of the effectiveness of the programs and policies that those organisations are delivering to people.
Professor Hawke, can you give us some specific examples? Would it impact, for instance, the search for a vaccine and or treatment?
We know from plenty of evidence that both sex and gender play important roles in health and illness outcomes. So within COVID, for example, a very clear example is that the kind of sex disaggregated data that we've been collecting in Global Health 50/50, which is national surveillance data, has shown that although there's pretty similar rates of cases in men and women, there's a much higher mortality rate in men in almost all countries where data is available. And when we look at the biological differences that might be contributing to higher death rates in men, we might begin to understand routes towards either vaccines or treatments once we understand why we're seeing differences in death rates in people.
Does the lack of women at the top in these key fields, given what you've just said, mean that gender differences in public health messaging, for example, is not being taken into account when it comes to targeting messages both for women and men?
Whether it's public health messaging or public policy or treatments or prevention messaging or prevention interventions, we're not seeing sex and gender being taken into account. For example, we know from previous epidemics like Ebola that there were differences in healthcare seeking behaviours between men and women. So men were seeking care later in the course of their Ebola infection compared to women. And that eventually led to a higher death rate amongst people coming to hospital who were men compared to women coming to hospital, because that timing can make a difference in terms of getting the treatment in place. So you need to understand these differences in order to be able to act upon them. If medical research or public health research doesn't even look at the difference, doesn't try to understand the difference, then it's missing a trick as far as tailored interventions are concerned.
Let's just pause there, Professor Hawkes, because from South Korea to Chile and the United States, there are indeed some high-profile female leaders in the health sector who are instrumental in the battle against COVID-19. Peter O'Brien has more.
She's a national hero in South Korea. Jong Eun-kyung is the director of the Korea's Center for Disease Control and Prevention and embodies her country's remarkable success against COVID-19.
이에 따라 이태원 클럽 관련된 확진자는 이전 확진자를 포함하여 총 누적하여 54명입니다. 이에 대한 추가적인 접촉자 조사와 감염원에 대한 역학조사는 계속 진행 중에 있습니다.
The GP turned public servant has dedicated most of her life to public health. She first came into the limelight in 2015 during the MERS virus epidemic and is especially praised for her insistence on transparency. In Chile, it's the Undersecretary of Health, Paula Daza, who each day updates the public on the virus and responds to journalists.
En el día de ayer se registraron 1.197 casos nuevos, lo que nos da un total de 323 personas fallecidas hasta este momento.
A paediatrician by training, she's also brought to light the explosion of domestic violence since the start of the lockdown. She's noted a rise in alcohol consumption, anxiety, depression and anger in families. The epidemiologist Deborah Birx, previously a military doctor and colonel, is the US President's coronavirus response coordinator, present at all the meetings and press conferences. Now famous is the look on her face when Donald Trump suggested injecting disinfectant to treat the disease.
And then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that?
Finally, we're all in debt to the first scientist to discover a human coronavirus in the 1960s, June Almeida. Thanks to her innovations in immune electron microscopes, the self-taught Scottish virologist identified a coronavirus of the same type to the one that causes COVID-19. Now her work is finally getting the recognition it deserves.
And with me is Professor Sarah Hawkes, the Director of the Centre for Gender and Global Health at University College London. In the scientific and medical fields, Professor Hawkes, what do female leaders bring to the table that possibly their male counterparts don't? Are they, for instance, less likely to be focused solely on data?
I can ironically respond with some data that when we look at the evidence of what difference it makes to have women sitting at the table when it comes to medical research, we know from a very large study that was done in Canada last year that when women are the senior authors on a paper, the paper itself, the research itself, is much more likely to take sex and gender into account than when men are the senior authors. And we know that sex and gender really matters in terms of understanding the course of any disease. So what we can say from that is that when you have women sitting equally at the table with men, you're much more likely to be in a position where you're taking all factors into account, including sex and gender. I think from other fields, what we know about female leadership is that it's much more likely to be collaborative and potentially more compassionate and more empathetic than male leadership. I think we've seen that very, very clearly in some of the political responses at the level of high politics, at the level of country leadership, as well as at the level of scientific leadership.
Professor Hawkes, it's been great speaking to you. Thank you so much.
Thanks very much, Annette.
And that's it for this edition. You can also connect with us via our Facebook page, that of course being France24.51%, or do send us a tweet at _51%. So until our next show, bye for now.